most of the time it's just quiet and because it's a test, you know, unless they really see that you're doing something that is not, you know, right, then you need a little bit of, guidance. Okay, so you will pick a card, and that card will tell you the time only. Administer medication, let's say at 10 a.m., and not the name of the medication, all right? To patient Justin Miluay, all right? So you will double click this. You will open the MD order and the MAR for IM sub Q, right? Minimize it over here in the middle. All right, so you will have the MAR and the doctor's orders. Usually they open on top of each other. You just drag it from the top and bring it to the side, all right? So you can see it like this, all right? So I will check from top to bottom which medicine I'm gonna give at 10 a.m. So 10 a.m. is Lasix, or what do we call this generic name? Furosemide. All right. So you have a chance to verbalize what you need to check right now, or before you give it over here. But usually we need to check all of the stuff that we need to assess before we prepare the medicine. So you can verbalize. Okay, I have this is a potassium moistening diuretic, so I need to check the potassium level, the BUN and creatinine for the kidney function, and I should have checked if she goes to urinate with the right amount. So they might ask you what is the right amount, what is a normal amount. And then also, this is good for this is potent blood pressure medication, so I should have checked also the blood pressure. All right, so with this one, they will all ask usually for the onset, for the insulin, onset, peak duration. They usually ask that, and also, of course, you have to check the. Well, you can bring your drug guide, so don't worry about that. What else do they check?
The blood glucose.
Yeah, blood glucose. You have to verbalize. This is for you check the allergies. This is PO, so you're not gonna give this one. Heparin is anticoagulant, so you have to check for bleeding, and prothrombin time, and they might ask for the antidote like that. So what is the antidote for heparin?
프로트럼빈 sulfate.
You're always the one
Yeah.
asking. Protamine sulfate. You're always. I know you're gonna ask. Regular insulin. This is the sliding scale. So if you get a card that says give medication at 8:30 a.m., you will be giving regular insulin, and the card will have the finger sticks or blood glucose. So if it says 200, you're giving 4 units, all right? If the card says 450, you're gonna give 12 units, all right? So it depends on the blood glucose. So do not, when you have regular insulin, they won't, they may ask you to mix it, all right, with the NPH. So make sure you practice that also. They might say, okay, but don't right away mix the NPH, all right? Do not, because here 8:30 and 7 is the gap of the time is far, all right? It has to be 1 hour, all right? So if the teacher says, oh, let's pretend the NPH also is 8:30, so mix it for me, then you mix it.
Okay.
Because it's also part of the test that you know the time window to mix these two medicine. Usually they don't say anything. All right. So if your card says 8:30, 8:30, If it says 7, 7, right? Don't mix anything. All right, so um, let's start after you mention all the things that you need to check. You will tell the teacher, I'm gonna check the 5 rights. Right patient, all right, right patient. Date of birth, of course, it has to be the same. Admission has to be the same. And then you go over here. Yeah, you can check for allergies. Yes, NKDA, no known drug allergies. Then furosemide. So that's why I'm telling everybody you need to know the generic name. You have the same medicine, all right? Right medication, right dose, 40 milligram, right route, IM, right time every day, all right? And then you verbalize my 6th right is the right documentation, which I could check later. And I have to check if the doctor signed the doctor's orders, so it's here. The doctor's signature is here. So to prepare the medicine, you only need the MAR, so you can minimize this and maximize this.
Can I ask you a question? Do you need to look at the doctor's order and verify like what they were prescribed is relevant to what their diagnosis is or what they're there for? Because they had mentioned that in lab. Like,
Yeah.
you want to look at the doctor's order and be like, okay, they were prescribed Lasix. Why? I need to make
Yeah.
sure that they're actually. But is that something that you need to do it for the exam?
You can say that. You know,
Okay.
It's not that's additional thing, but you know, it's just gonna make
Or like
bad-
indications.
Yeah. Yeah, you can
Well,
say
like
that.
you would
can
say, like, okay, I want to make sure that what the doctor prescribed is actually the right thing. Like, does it make sense for this person to be receiving this medication?
You can do that. You can do that. You can mention that I'm gonna check the diagnosis. You
Okay.
need to know. You need to read everything, anyways. You know, we're just making to make the flow faster. You know.
Okay.
You verbalize things that are important just for the practicum, the performance exam.
Okay.
So, but you do read all the information on the MAR and the doctor's orders. You do need to know you need to have almost everything the same. You know, of course, especially the patient's name and the date of birth. You know, all right. And the diagnosis, of course, has to be the same, right?
Should we clarify the order's expiration date?
Yeah, you can also tell that.
Okay,
So,
but over
I
there
want to
it's
check-
over.
yeah.
It's the due date is over. It's December 5th, right?
So orders in the acute setting usually last for 3 to 5 days.
Oh.
But sometimes if you're in the nursing home, it's longer, like weeks, because it's like a residential, you know. But acute facilities, sometimes it's only days. So even if it's today and then you're doing your test tomorrow, this could be still good.
Okay.
So it depends on the policy of the hospital. All right. So let's say some hospitals. Antibiotics is only good for 3 days. Orders for antibiotics is only good for 3 days. So if this is the 3rd day, then you have to look for the doctor and make the order again, because it's expiring. You know, it's expiring that day. All right. So what's next? We will wash our hands. All right. We're gonna gather our supplies. So. We usually have our medication card to open the drawer there. Not that one. This one, the M. All right. You click this. There. So it's blinking, but sometimes you do need to bring that arrow there and click it and scan. All right. The student ID, this one, not this one, student ID. So you will look for, most of our cards, you can open all the drawers like together, you know. Like,
This one is not.
but I don't think this was a, so you get yours, you look first. Look, I have So you're gonna get for Lasix is an IM, all right. So you need your 22 gauge by 1.5 inch, all right. Needle, get 2. You need to switch later, and 3 cc syringe or 3 ml syringe, all right. If you're giving heparin, you have a choice. You can either use this TB for heparin, all right, or 3 cc with 25, or this one. We have a different one, but this is still okay with heparin because this is for subcutaneous. The needle. We check the needle, all right. So this one is good for heparin. All right. So that's we're doing. Okay. So it's closing. Don't worry about that. You can open it. All right. So our alcohol is also there in the cart, but we have alcohol on the table also, so you can get 2. All right. And then we look for the patient's name, Justin Luad. Okay. So where's my?
Oh, no.
No, heparin. So keep this open, the medication drawer or the patient's drawer, because you need to do the 3 checks before you and then return it. All right. Oh, it's open. Yeah. Let's see. Here. All right. So we're gonna do. You verbalize. I'm gonna do my first check. So all the information on the bottle label against the MAR. So Justin Uluad, all right, furosemide, A6, 40 milligram. I'm taking 1 ml. Expiration date, it's good. And then you scan, all right. You can open this pad to scan, so you can also check the number, all right. Usually it doesn't go, but you do the
Just pretend we're.
yeah, because we didn't put this, the vendor did it, okay? So it's not our barcode. So you do that, and then you do your second check, all right? So to separate the first from the second check. Justin Uluad, expiration date, furosemide, 40 milligram, taking 1 ml. Okay, you get your alcohol swab. You will open this. You will go, just swab it. You don't need to go like this. If you have the green cup here, you just open it. You don't need to swab with an alcohol. All right. So you can prepare this. I have an assistant. You want to do it? Yeah, you do it. Oh, here. Make sure that do not contaminate the sterile parts. All right. And make sure also that it's secure. Oh my God!
Don't take out.
You're scaring me. All right. The best way to take this for your safety, this cup, is to go like this way, versus going up like this, because we tend to go back, so we're gonna poke ourselves. We going up, sometimes we have a small area. We don't usually go right higher, but if you go over here this way, you have more space. All right, so for safety, we go like this. All right, so we're gonna go put this over here. Make use of that one, although we don't have that in the clinical. You will put 1 ml of air. So we follow that line, not this one, all right? And some of our needle, there is a hub in the middle. Do not follow that, just this one, the line that is close by the barrel, yeah, okay? So we will put the needle in the middle and push the air in, all right? and invert, and make sure that the needle is underneath the medicine. All right, so in the beginning it's kind of it's better to go back and forth, all right, so that you're not gonna be like getting big bubbles. See, I'm getting big bubbles there because my needle is kind of. What happened? Let me just check. No, it's not.
It's outside of the.
No, I think it's not properly. You didn't put it properly.
Second check is
It's
You put it all the way on the side.
calculation. Before you draw the
No,
medication,
you have to
do calculation.
twist this all the way down, right?
And then
Because it's leaking. It's leaking.
Oh.
All right.
I don't remember.
All right. You have to make sure
Confirm
that
first
the
time
needle
and
is all the way
scan
down.
is the first check.
It's gonna
And
leak,
then do
and you're gonna get
calculation.
also air.
And
All right.
calculation already done, and you can just do it. And then second
So go
check.
back there.
Then you take all the medication. Third
You
check.
can get more than a line or two and flick the bubbles away.
Can we take out and put some air inside? Easier for us to take out bubbles. I saw one student do it. Just take out more medication and pull out the air inside and split. Make the air can go out and just push up. We can do that way, or
Take
we
it
must
out
do.
from the bottle.
Yes,
No.
we can, right?
We cannot.
Okay, just this way. Okay.
That's only in the movies. We don't do it like that. Like the doctor going like this, squirting the medicine out. No, we have to put it. The needle has to be inside the bottle. All right. So push it back. All right, and then we're gonna go over here. All right. You can recap right now because we haven't technically used the needle. So I'm going to do my third check, newlywed, Justin, furosemide 40 milligram. I took 1 ml. You check I do have a bubble. You can go back and remove that, but we'll continue, all right, because of time.
Okay.
All right, so expiration date. All right, so after this, we will put this away, all right? And then we will verbalize only because we're not going to a real patient. You just verbalize this that I'm gonna switch needle, only for IM, all right, to prevent irritation to the muscle layers, all right? So you can put this back if you have, if your drawer is open. All right, so you're going to the patient's room, grab your gauze, bring your gauze, I'm pretending this is a gauze, and your alcohol swab, and your gloves, okay? We will come over here and introduce ourselves. Hi, hello, my name is Marlene. I'm from La Guardia Community College. What is your name? What is your date of birth? Then you go grab this scanning device. You scan this, all right? You see the number, you can compare it over here as the same, all right? So here's the real patient, all right. I'm here to give you Lasix. Not Lasix. What is that? I'm giving furosemide. It is Lasix, right?
Yeah.
Yeah, it is.
Yeah, I was thinking furosemide, Lasix. I'm giving you furosemide. Are you allergic to furosemide? Always check because patients sometimes are allergic to other, not just antibiotic. Sometimes they are allergic to aspirin, Tylenol, all those medicine. So if you're giving IM medication, you will be asked to give one IM site. Usually the teacher will tell you which one. So we have deltoid, vastus lateralis, and ventrogluteal over here on the side. All right, so we will, they usually want you to say the landmarks. So I'm gonna palpate the acromion process. Sometimes they do ask the students to locate it on your body. So make sure that you know where the landmarks are. I'm gonna palpate for the acromion process. I'm gonna put 2 finger breadths down the acromion process and above the axillary line. Above that axillary line, you can put the V, and you go in the middle of the V. All right? Are you, is that clear? Do you have any questions? The sides are in the steps.
That's not very clear. That's why when you can perform. Tell something very.
That is clear.
Okay.
Yeah. So a cramming process, 2 finger breaths is approximately 1 inch. Okay, so this point and axillary line, you know, the armpit line over here. It's between those 2 points, all right? But to make it precise, you tell the teacher I'm gonna put my fingers like this, and I go in the middle of the V, all right? To make the site precise. Where is it? So the other one is the vastus lateralis. So between the greater trochanter and the patella, you're gonna divide this into 3 equal parts, and you go in the mid-lateral, on the side over here, lateral, all right? So the other one is the ventrogluteal. So we need to make our patient lay down sideward. So it's better if the patient is the patient is facing you, so you can see his expression if he's hurting or whatever. All right, so you're gonna go. You're gonna flex the legs, all right, so that it's easy to go in. All right, you will tell the teacher. If I'm using my patient's left hip, I'm gonna use my right hand. If I'm using my patient's right hip, I'm gonna use my left hand. So opposite, all right? So this is my patient's right hip.
Right here.
I'm gonna use my left hand. So with my fingers pointing towards the head of the patient, I'm gonna put the heel of my hand on top of the greater trochanter and the pointer on top of the anterior superior iliac spine. And this one, the middle finger on top of the iliac crest, and we go in the middle of the V. You can add this thumb is pointing towards the groin, like that. But the V over here is the side. Okay. You have any questions? So if you have a subcutaneous medicine, you're gonna give a subcutaneous site. All right, so we have upper outer aspect of the arm, you know, where we have our bat wings, you know. All right, over here. All right, so the other site is over here by the top of our legs here. So between the greater trochanter and the patella, we're gonna divide this into 3 equal parts. So you're gonna be on top, and we use the middle anterior, front, middle anterior. Okay, for the abdominal area over here, between the costal margin and the iliac crest, you can go anywhere as long as you stay 1 inch away from the umbilicus. So 2 finger breaths, because 2 finger breaths is like 1 inch, an estimate of 1 inch. You go like this. All right, so go like that. So you can inject it anywhere. Yeah. All right. Cool. All right. So we're not going to the mannequin because we don't want molds on our mannequin. We will go to the injector pad. So, do you have gloves? You will wear your gloves.
Thank you so much.
Oh, let's get the. Okay, you can prepare this. You have your gloves. I think this is the wrong glove. Yeah, they inserted this in the large container.
Oh.
Okay, my hands are
It's after you finish injection, you have to gently pressure on the patients.
All right, so they are very particular with the wiping, so make sure that you wipe the site properly. You have to go how? Circular
Starting
motion.
from the middle and circling outward, right?
Yeah. So we will wear our gloves and we will go circular motion.
He's like, whoa.
So open a new one. All right, we will go in, out. All right, about 2 inches, and then you get your gauze. All right, you can put it over here. I will wait for it to dry. I don't think you're gonna wait for y'all during the performance exam because it will take time. If you're giving IM, you will go 90 degrees. For sub-Q, you have to waist 90 or 45 degrees, but usually they ask for 45 degrees for sub-Q because they want to see your technique and how to go in and out. All right? So 90 degrees is straight. Do not go like this, like that, you know, straight. All right? So first you're gonna spread, go in, all right? You can hold it over here and then just, or if your fingers can it can reach the plunger, then you go.
Oh, so we don't have to use the undominant hand, right?
Not necessarily.
Oh, okay,
all
okay,
right?
okay.
All right, so grab this right away and put pressure about 2 to 3 seconds. Check if it's still bleeding and then you cover if it's bleeding. Now it's okay, so we don't need Band-Aid, all right? So this one, to close this, you use the table. You want to try? Who wants to try?
Wait, do we have to like pull it when you
There,
inject?
excellent. Straight. No, you don't need. You don't need that. You don't need to do the Zitra. All right. So after that, we will go and remove our gloves. We will talk to the patient. Mr. Newlywed, I'll be back in 15 minutes to check on you if there's any allergic reaction. So, but you will go and document over here. So you need to look for the date. Tomorrow is 12:06, so you can go over here and put your initials here. Not there. Why is it not? You just enter it. Over here. So you put your initials over there, where the box is, and then put your initials over here and see, and then your full name. It's a signature, but it's a readable signature. All right, and then your title, SN. All right. So next, you will verbalize. I will also document this in the nurse's note or nursing note. I'm gonna write the date, the time, the medication that I gave, how much it is, and how the patient tolerated the medication. That's it. You pass.
All right.
You pass. All right. Okay. So you have any questions?
That's a lot.
It's a lot. It only sounds a lot because I'm explaining things, but you don't really need to verbalize. Oh, I'm gonna get this.
So first check.
From the drawer like that. But you don't need to do all those things.
Oh, so we can just grab the
grab it,
insulin
you
and
know.
syringe. We don't have to
But,
explain.
it is important to say that you're doing the 5 checks between the MAR and the doctor's orders, and
5
don't
rights?
5 rights. Right, you're right.
So yeah, 3 checks.
And
so
3 checks for the medicine.
first
That
check.
is important.
First
alright?
check is after dispensing, after we take the medicine out,
Yeah,
and then second check is after we scan the
the
medicine,
medicine. Yeah,
and the third check is after you prepare the medicine.
yeah. After you have it in the syringe.
Yeah. Okay.
Okay, before you put it away. All right, in the drawer.
Now I got it.
Okay. All right. So practice.
I have a quick question.
Yeah.
How do you decide which obviously for insulin you're gonna you would choose an insulin syringe, but for the rest of them, how do you choose which barrel you're pulling? Which syringe?
Which syringe?
Yeah.
Basically, you can check the amounts you're giving to the patient. Let's say heparin, right? If you look at the for heparin, what's our heparin? Heparin, 5,000 units is equivalent to 1 ml. So 1 ml, so you can get a 1 ml syringe.
I see.
All right. You can also use. Somebody asked me, why
one's
can't
1
you
ml.
use 5 ml? You can use 5 ml. That's fine. But why waste 5 ml, right?
Right.
If you have smaller syringes, so you can use this one or that
What about that needle?
3
Which is
cc. 3 cc is also okay. That's also the thing that we have to check, the gauge of the needle. So the gauge of the needle for subcutaneous is 25 to 29. We do choose the smallest. That means 27, 29 is better to give to the patient because it's less painful, right? But if you have no choice, 25 to is still good.
Oh, I
right?
see. Okay.
The smaller the needle, the better when you're injecting.
So we can use a 25 gauge
Yeah.
for subcutaneous during performance.
Yeah, except
27.
for insulin, right?
Yeah.
Except for insulin.
insulin. Which one we have to use?
Insulin is insulin.
So, which one?
Oh, there's the one that it says insulin.
Yeah.
It already has like the needle on there,
Yeah,
right? Yeah.
it has the needle.
Okay.
This one also has the needle. But we have also TB the TB one, you can use that one. You cannot use that for
I cannot
insulin,
click there.
but you can use that for heparin, right?
You can
Even
use
this
TB for
needle?
heparin. Can you use the insulin for heparin as well?
The insulin for heparin?
Yeah.
Oh no. You need to use the TB.
But this.
This is also for TB. You see the gauge, 25 by. Oh, the length of the needle, that is for subcutaneous.
This is for sub-Q.
Yeah,
length
so you
is
can
1
use
inch?
that one. 5/8.
Oh, 5/8.
Not 1 inch. 1 inch, you will go straight. You will pass the subcutaneous layer.
Right, 1 inch is
So the length of the needle is
So that's for
supposed to be
insulin?
less than an inch. So
Yeah,
half
less than an
inch
inch.
to
Yeah, 5/8.
No,
you
insulin
would use
is
this
only
for
for
heparin.
insulin. Insulin is 500 units. That's the only one for insulin. Over here.
Open the other
Miley,
box.
this one, when we put the what? We have to put the.
If you got regular insulin, you put your initials over here.
It doesn't work.
You have to fix that.
Oh, okay.
You can move it. Let's say you move it over here. You can probably box. You can backspace.
Oh, now I do.
Oh, now I move it. Let me fix that.
We put the glucose and
Yeah,
The
finger
dosage?
sticks and yeah.
It might be
we
in
just
the
put
other
the end
drawer.
between the dosage and the finger stick. Okay.
What does FS stand for?
FS is finger stick. The glucose number. Oh. And the dosage is units. Professor gonna tell you. There's one draw card tell you is how much
That's
glucose.
tuberculin. So that would be like a
So we can use this for heparin.
How would we
I
document
don't
it? We
think
put this thing slash.
if this says
dose?
tuberculin, could you use it for
For the
sub
end.
Q?
Even this
Oh,
needle,
okay.
we don't have to change the needle, right?
I thought tuberculin was for intradermal, yeah.
The gauge number.
You can, but you could also use it for sub Q. Got it.
Because of the
Oh,
length?
because it's 27
Yeah.
27
Because
gauge
of
and
the
half
gauge,
inch.
The gauge. You can use that.
Will you open this other drawer? Oops, I want to see if there's a.
You have to close those two.
Okay.
Close them.
Oh,
I think this is.
That's
Yeah, this is
insulin.
an insulin syringe.
oh yeah, that's what I need.
Okay, this one you have to be careful. This is the safety device. So when you're preparing, you have to hold it over here, down the safety device. Because sometimes people will hold it over here and they keep on pulling the, they will, you
Put
will
that one
pull
up.
this going up, and if you bring it all the way up and you hear the click, that's it, you're not gonna use the, because it's gonna lock up, it's gonna, you know, you have
So
to
that is
throw
for
it away.
insulin.
This is for insulin.
You say we don't use this for insulin. No,
It says insulin.
You can only use an insulin syringe for insulin.
When you
Yeah.
touch,
For
don't
any other
touch
thing like
here.
heparin, you can use
Only
any
touch here. Because if you touch here, when you draw, maybe this one
can't
go
use this
up.
for
You,
heparin.
you heard the sound.
Oh, it says insulin
It's done.
only.
You have to
Right, you
restart.
would only want to use an insulin syringe.
Yeah.
We can't use it for heparin, but it's super cool.
So, I have a few more minutes to
We don't
be
ask
with
for
you.
it.
Who wants to practice?
I am is the
Can
only
we-
one we do.
can we do an
aspirate, but for
IV?
the performance
Is
exam,
that
we
how
don't
IV?
have to.
All right,
We
yeah,
don't
all
have
right.
to.
So that's, I thought you want to practice.
I do. I want to do it all.
Just
Everything. But I want to. I can practice, but I want to at least see the.
I have a question.
Yeah.
For the IM, do we have to verbalize? Like, do we aspirate? Like,
You don't aspirate anymore for IM.
okay.
In reality,
Yeah.
so we don't. Oh, okay.
You don't
okay.
aspirate. Period.
Okay.
Not
Something
even
on the textbook
in the
doesn't happen
performance
anymore.
exam. We don't. Before we used to aspirate, but not anymore. They found out it's not. It's not useful. You know, not as. There's no use for it. All right. So, let me just save this. All right. So, I don't have the. Let me show you.
Ivy.
IV. So
Ayo. There's water.
that's okay.
It was good. I went over my exam and I made so many stupid mistakes. Like everything that I got wrong was so easy, and I got like all the hard questions right.
The same thing happened to me. I was like, what?
So I'm like, well, I
So,
guess it's better that way because I'm like I know the harder stuff.
She was like, that's a lot of us in this class have the problem.
That's what happens when I do one-on-one review every time.
I was so mad.
She would yell at me.
She's like, you could have gotten almost an A.
Yeah.
You could have gotten like an 88 for sure, like easily. I'm like,
That's what she said.
This is my
Gloves?
gloves. This is mine, right?
well,
Whew, okay. So,
Which one do you want me to do?
let's say your your card says give number one IV order. All right, number one or IV order.
Okay.
So
normal saline.
yeah.
That's acid.
We in
So we
some
check-
hospitals we do not have MAR, all right, for the
IV.
IV. But I guess some hospitals they do have it, but most of the time they don't have it. So what you can let's do the MAR, but but not all the time. Anyway, so we're gonna compare the MAR. So you
right
yeah, right
patient,
patient, right
right
fluid. It's not medication, but you do
Right fluid,
Yeah, right,
right
dose,
dose,
and
right time.
And then
Right document.
so it's not it's actually
What else?
Favorites because there's no
oh there is
medication.
IV. There should be IV route. Yeah. It is
Right
five.
route?
Yeah, right route. So
there's no
IV.
times on there, right?
8
8 hours.
8 hours.
Over 8 hours.
That's what
yeah,
you would do for
yeah.
the time. Okay.
And then you will tell of course you have to check the date of birth, if there's any allergies, right?
No.
And the doctor's signature. This
And
one.
doctor's signature.
Okay, you can close that. You can start with, we can go with,
Anyway.
you will grab your right solution. Make sure you get the right solution and the right amount. All right, so when you get it, you will tell the teacher, I'm gonna check for expiration. It has to be clear, no sediments, no cloudiness, no leaking, all right? And the cover has to be intact over here. So the card will also, to make the flow of the test faster, the card will tell you also which tubing you're gonna use. So because in reality we do a couple of calculations, but to make the flow of the test faster, we have the card will tell you use macro tubing, use micro tubing. All right, so make sure you know which one is macro, which one is micro. This is micro, all right? And then you get the right tubing, you get the labels. You need the label for the bag, and you need the label for the tubing. So the tubing is good for 72 hours. So if your test is tomorrow, then you will get Sunday, right?